Hello everyone, my name is Erin Hermits and I'm doing my persuasive speech on the importance of dental hygiene. It is more important than people think. It affects your body as well as your teeth, your gums, your mouth, your heart. It affects your whole body. I have experience in the dental field of 3 years. I've worked as a dental assistant for a few months and a hygiene assistant for most of the time. It is very rewarding to work in the dental field. It helps you see the reward of maintaining your good health, and it helps you see the downfall of poor health and how people don't take care of their teeth like they should. 90% of adults suffer from some type of gum disease at some point in their life, and a lot of them don't even know that they have gum disease. That's why it's best to brush twice a day, floss once a day, and visit your dentist twice a year to maintain your health. Tooth decay and gum diseases are two very important and significant results of poor dental hygiene. Tooth decay is the same thing as a cavity. Tooth decay is when much of the tooth's minerals, solvent or mineral content dissolves away from the tooth and the gums, and it leaves a hole, which is a cavity, so you have to get a filling, and if that is left alone and not taken care of right away, it can cause a root canal or possibly a crown and money you don't need to spend. And here are some pictures of people with tooth decay, not very pretty. This first one is from drinking Mountain Dew a lot and smoking cigarettes. And of course, if you do that, you don't look like this. It's from obviously not brushing your teeth as well. And this second one is from probably a meth addict or drinking way too much Mountain Dew. And then this third one is a baby tooth, which has the hole in it and the tooth decay around it. Gum disease is plaque buildup around the gum line, and it traps food and germs, and it attacks your gums and then causes bleeding and soreness and irritation. Plaque left under the gum line too long hardens and calcifies and is then called tartar or calculus. Controlling your plaque and tartar buildup is by brushing, flossing, and visiting your dentist. And there are 2 stages of gum diseases. Well, first of all, this is what healthy gums look like. They're pink, they're firm, and they do not bleed while brushing or flossing. This shows some of the plaque. You can see it's sticky, thin film, and it is constantly forming on your teeth by food and drink particles that sit on your teeth too long. And here's the first stage of gum disease, gingivitis. It is red, swollen gums that bleed easily, and if this isn't taken care of properly and right away, it leads to the second stage of gum disease, which is periodontitis. And there are 3 substages of periodontitis, which the first one is early periodontitis, obviously. And your gums begin to recede from your teeth, which forms these pockets. And eventually, if this is not taken care of, then you lose your bone loss and your tissue becomes inflamed. The second stage of periodontitis is moderate periodontitis, and your pockets deepen and your gums recede from your teeth more, and they're irritated, and your teeth begin to loosen, and eventually they will fall out if they are not taken care of. And the third and last stage is severe periodontitis, and your pockets deepen severely, and you may form pus pockets, which as you can imagine, are gross and not healthy at all. You have very severe bone loss, and your teeth get loose from your gums. These pockets, your gums reside or receding, and eventually your teeth fall out or they have to be extracted. So this is not a very good way to lose your teeth, obviously. So that's some visuals of what happens to your teeth with gum disease. Now I'm going to go over the brushing and flossing technique, which a lot of people don't know how to do this the correct way, but there is a right and a wrong way to brush. You want to angle the toothbrush where it meets your gums and your teeth, and at like a 45-degree angle. Go all the way around your mouth. Make sure you get the tops of your teeth and the lingual side, which is the tongue side. And just go all around, and that's pretty much it. And then with flossing, you want to wrap your middle fingers around the floss and go in between the teeth and do a C-shaped curvature, and don't saw back and forth because that's not very healthy. That irritates your gums. And you just go in between. Out. And back into the other side. And you don't have to do every tooth, but you need to do the teeth you want to keep. Diabetes is another downfall from poor dental hygiene. Oral disease is the most common thing that affects people with diabetes. Having diabetes makes you susceptible to oral infection more than someone who doesn't have diabetes. Oral infection is caused by a group of germs that settle in a certain area and begin to irritate your gums. Oral infection causes pain, swollen gums, and pus pockets. And diabetes is prone to thrush, which is a fungal infection caused by high blood sugar. And it is white, sometimes red, mostly white patches in your teeth. And you have painful ulcers. And if you have good hygiene, you are obviously less likely to have thrush. Good hygiene is more important than you think. Like I said, it doesn't only affect your mouth and your teeth and your gums, it affects your body and your health as well as your heart. It is painful as well as costly. I mean, wouldn't you rather spend your money on something worthwhile other than fixing your teeth? It is not very hard to brush twice a day, floss once a day, and see your dentist twice a year. I mean, I think we all have time for that. With good hygiene, you live a longer, healthy life, and people don't really notice the effect of poor hygiene until you have a gum disease or a cavity. But diseases like gingivitis and periodontitis result from this, and I think it is worth your while to brush your teeth and maintain your health like you should. Thank you.